Chapter 13, Careers in Therapeutic Exercise. Chapter Objectives. Acquaint you with the wide range of professional opportunities in the sphere of therapeutic exercise. Familiarize you with the purpose and types of work done by professionals in therapeutic exercise. Inform you about the educational requirements and experiences necessary to become an active, competent professional in the area. Help you determine if one of these professions fits your skills, aptitudes, and professional desires. What is therapeutic exercise? Systematic and scientific application of exercise and movement experiences to develop or restore muscular strength, endurance, or flexibility, neuromuscular coordination, cardiovascular efficiency, and other health and performance factors. Programmed physical activity aimed at improving or restoring the quality of life. Classified as being either rehabilitative or habilitative. Core competencies. Core competencies for individuals who provide patient care have been developed by the Health and Medicine Division, formerly the Institute of Medicine, of the National Academies of Science, Engineering, and Medicine. They are: provide patient care, work in interdisciplinary teams, employ evidence-based practice, apply quality improvement, use informatics. Reassessing disability. Focuses on what a patient can do, diminishes stigma. International classification of functioning, disability, and health. Goal of therapeutic exercise professionals is to help people restore lost function, rehabilitative therapeutic exercise, or acquire skills and functions considered normal or expected, habilitative therapeutic exercise. Rehabilitative and habilitative therapeutic exercise defined. Rehabilitative therapeutic exercise refers to processes and treatments that restore skills or functions that were previously acquired but have been lost because of injury, disease, or behavioral traits. Habilitative therapeutic exercise refers to processes and treatments leading to the acquisition of skills and functions that are considered normal and expected for an individual of a certain age and status. Professional opportunities in fitness and health were addressed in Chapter 12. This chapter considers services for habilitative and rehabilitative therapeutic exercise. Rehabilitative therapeutic exercise. Exercise therapy for the rehabilitation of the following: musculoskeletal injuries, athletic injuries, post-surgical trauma, cardiopulmonary rehabilitation, older populations, or psychological disorders. Habilitative therapeutic exercise. Exercise therapy for habilitation of the following: specialized debilitation, meet standards that exceed rather than merely meet those of the general population, such as sport training, military boot camp, fire or police academy. Obese populations, children with developmental disorders, or general fitness. Sedentary lifestyles. Societal changes have negatively affected the health of a significant portion of the population. The information age has created a relatively sedentary group of people. Therapeutic exercise, even in the form of casual recreation, can offer a more balanced lifestyle. Settings for therapeutic exercise: inpatient facilities such as hospitals or residential facilities, outpatient clinic settings, e.g. physical therapy offices, sport team settings such as athletic training clinics, or private practice, which are entrepreneurial in nature. No matter what the setting, you will have opportunities to work with other professionals. Indeed, most healthcare facilities use a team approach in which representatives from several professions collaborate to plan and deliver patient care. Roles for therapeutic exercise professionals. Credentials for each profession vary, overlap, and change regularly. Pay careful attention to the changing required employment standards for education, licensure, and so on. A strong science base and an active clinical education component are critical to your preparation and success. The need for multi-skilled and multi-credentialed individuals will increase as competition in the healthcare industry increases. Athletic trainer. Responsible for the prevention, evaluation, management, treatment, and rehabilitation of athletic injuries. Mostly found in athletic and clinical settings. Education and credentials. As of 2022, ATs seeking national certification must graduate from an entry-level master's degree program accredited by the Commission on Accreditation of Athletic Training Education. Board of Certification, BOC, Canadian Athletic Therapists Association, CATA. Employment opportunities, high schools, colleges or universities, pro sports teams, hospitals, sports med clinics, industrial rehab, and other allied medical settings. Clinical exercise physiologist, cardiac, pulmonary, and metabolic disease care, exercise testing and prescription, program administration. Education and credentials, recommended undergraduate and graduate degree, as well as specialized courses and certifications, especially through ACSM. Exercise specialist and registered clinical exercise physiologist certifications additionally. Required credentials vary by state. Employment opportunities, the growth of an aging population means more jobs. Occupational therapist, helps people with physical, emotional, or mental disability restore or develop maximum level of independence by emphasizing acquisition and retention of functional skills. They help improve concentration, motor skills, or problem solving. Education and credentials, National Board for Certification in OT, Physical Therapy Specialty Certifications, state licensure. OT requires a master's degree, some doctoral degrees, and COTA, or Certified OT Assistants, require a 2-year degree program. Physical therapists provide a rehabilitative care to a diverse patient population with a wide range of injuries, illnesses, and diseases. Education and credentials. PT, who plans, directs, and implements patient care, requires a master's degree program with a doctorate of PT required by 2020. State licensure, physical therapy specialty certifications, and a commission on accreditation in PT education. Physical therapist assistant delivers care under the direction of a PT, must complete an accredited 2-year program and receive state licensure. Therapeutic recreation specialist treats people with physical, cognitive, emotional, or behavioral disabilities to restore function and reduce or eliminate the effects of disability and develop independence. Utilize leisure activities to restore function. Education and credentials required: a bachelor's degree in therapeutic recreation, internship under a certified recreation specialist, and national certification exam. Employment opportunities: limited growth because of cuts in hospital settings. Strength and conditioning specialist maximizes physical performance, reduces the frequency of injury, and decreases the possibility of cardiovascular disease by designing programs for the specific needs of the individual, sport and activity specific. Education and credential requirements: a bachelor's degree in kinesiology preferred and required for some certifications. Certifications recommended such as National Strength and Conditioning Association and current CPR certification. Are you clinically or technically oriented? Do you prefer to devise solutions on your own, or would you rather follow a structured sequence of steps? Clinicians devise and develop therapeutic exercise plans and are called on to solve problems and make decisions. Technicians, in contrast, are experts at performing a specific set of skills. How might the way you answer this question impact your thinking about your career path? Trends and opportunities in therapeutic exercise. They fulfill a societal need, assist in attaining desired levels of fitness, habilitation, assist in regaining lost function, rehabilitation, cover a wide range of population, from newborns to geriatrics, athletes to unskilled performers. All professions in this chapter place increased emphasis on identifying physical barriers to activities, for example, issues of strength, range of motion, and cardiovascular limitation, and biomechanical factors that may increase the risk of injury.